I'm 45 and 5-6 years ago, I pulled or tore a muscle in my left side of my lower back while I was lifting my dog. It was 70 pounds over a thorn bush and he got stuck behind. And all of a sudden I felt a distinct and horrible tearing sensation in my lower back. Seconds later, I was lying on the ground in the worst pain of my life. Somehow I managed to crawl a half a mile down a dirt road back to my car, where I discovered I couldn't sit still and drive. Although I couldn't walk without intense pain, I drove the dog and I 1 mile home. It was days before I was able to get out of bed without severe agony on a scale of 11 out of 10. Even rolling over or trying to walk was like being stabbed in the back with a knife. I couldn't sleep because each time I rolled over, I'd wake up. I actually cracked a tooth from grinding my teeth, so hard in agony. After getting around with a walking stick for 3 months, the pain eventually went away. However, since then, I've repeatedly re-injured the exact same muscle. Just doing everyday things like sneezing or bending. On average, once every 5 to 6 months, sometimes the pain isn't as bad as the first time and I'm able to recover within a few weeks of Epsom salts bath, Advil and muscle relaxers. Other times, it's the same intensity of the original pain. I've seen several doctors and physical therapists and they have all told me it's not likely to be structural issues since the pain is localized to the injured muscle and I don't have any shooting pain or numbness. So I haven't had any x-rays or an MRI. After the last episode I did 6 months ago, I did months of intense PT, joined the gym with a personal trainer and received lists of exercises to do and lifting advice. I have been keeping up with the exercises, lifting everything super carefully and never pick up anything heavy. I was so proud of myself. But last week I cheated and lifted 2 heavy bags of groceries at once as I was running late for work. I felt fine afterwards, but the next morning I leaned down to grab a tube of toothpaste from a low pantry, slipped and ouch. I felt the same old familiar stabbing pain again. I don't know if I'm tearing the muscle each time or the muscle is going into spasm to protect itself, but one thing is for sure, it hurts like the blazes. I'm in tears of pain and frustration right now. There's so much more I want to do with my life. I want to be able to travel a globe with my spouse, go on remote hiking expeditions, and I'd love to volunteer with a local therapy horse program. But I'm terrified of leaving home in case I tweak my back again and end up in severe pain in a remote place where I can't get to a doctor. I'm afraid to even get on an airplane since any trip would involve me carrying lifting luggage. I haven't been on vacation 3 years, so I'm afraid of injuring my back and ruining the trip. This is starting to cause issues between me and my spouse. Okay, so that's a difficult situation. My first instincts are he's not rehabbed well enough. Now, he might be physically rehabbed, as in, he done his exercises, he done his intense PTs. But the language that I'm speaking from him, or I'm hearing from him, is that he's afraid. He's avoiding doing things. And that speaks volumes, because if you're using that type of language, that's based on your thought process, your fears, your worries, anxieties towards general day-to-day movement. You can go into the gym and you can do deadlifts and you can do squats and things like that. But generally in day-to-day movements, you don't lift something within a deadlift position. Like if you're like he said, he had to lift 2 bags of groceries quickly because he was running late for work. If you only rehab yourself to be able to lift something in like the general PT way, which will be with your back in extension, then you'll only become very strong and safe in that position. And what happens then is your body doesn't feel safe in, let's say, a flex spine, or be able to manage load in a flex spine. And then what tends to happen is in the future, if you're running late for something and You're not in the mind frame to lift with it, which something with your back in extension. Well, then you'll move into that position that's unfamiliar and where your body doesn't have conditioning. Their brain is going to be a little bit more protective over that area. So it can go into spasm and it can go into a protective response because it remembers the previous injury and doesn't want you or doesn't want him to get injured again. So it can just create actually the exact same response without tissue damage. Now, he could have injured his back. He could have damaged tissue again. But in all likelihood, the fact that this happens so frequently, it's unlikely that he's re-injuring the same area over and over and over again. We're actually not that fragile that you constantly keep re-injuring yourself that way. It's more likely that his body doesn't feel safe in that position. And then when he moves into that position, maybe aggressively, or if he lifts weight in that position that's unfamiliar, his body's just going into that protective response. And the fact that he's using that language like, I'm afraid, I'm avoiding, I'm terrified, that's telling me that those words, and these are things that doctors and physios and physical therapists, they should be picking up on that language that he's using. Because if you're using that language like, I'm afraid, I'm terrified, then you're not rehabbed. Because rehabilitation isn't just being able to lift weights in extension. It's actually be able to move and be confident and strong in the environment that you want to go back to. And for most people, it's just being able to do things like around the house, like even some gardening, or, being able to just lift the groceries in or play with your kids. So if you're not able to, if the rehab isn't based around the person's life and it's just based around just general gym exercises, well, then I don't think that this person's rehabbed enough. And the fact that he's using that language, in my opinion, he's not rehabbed enough. Now, there are other things that are going to be playing a part in this. You might have seen there that he said that he lifted the 2 bags of groceries and he felt fine afterwards. And it was the next day when he went down to lift the tubes of toothpaste, that's when he injured his back. So it's unlikely that the flare-up was caused by lifting the bags of groceries, because his body's not going to wait till the next day to create pain for something that caused an issue 12 hours or 24 hours before that. So it's most likely due to the fact that he bent down to pick up the toothpaste, and at that point, his body didn't feel comfortable or safe in that position. So it went into protective response and spasmed up and inflamed up, or like potentially even strained tissue again. It all depends on how conditioned he was in that position. And there's other things. So I use like an analogy, like a glass of water. So everybody has a glass of water. Let's say it's hypothetically, it's half full. Okay. Now, each stressor that you have in your life would be like a little pebble dropped into that glass of water. And depending on the stressor within the body and how it's able to manage it, that pebble can be a small pebble, or it can be a stone, or it can be a rock. Each one of them is going to rise the water level higher. Now, you could have a lot of pebbles in your glass, and it could be things like working long hours, relationship issues, fear, stress, anxiety, suffering with depression. All of these things are different stressors. They're just different demands on the body, and it's rising up your glass of water. And it could be a case in this person's issue is that he had a lot of pebbles that was rising up his glass of water, and his glass of water was at the rim, and then suddenly he bends over, picks up the toothpaste, and that's enough for that last pebble or stone to go in to overflow the glass, and then his body perceived danger and then went into that protective response. Everybody only blames what happened in the moment. They don't blame what's been going on in their life. Have they been sleeping well? Have they having relationship problems? Are they stressed out in work? Have they been working overtime? Have they been able to do the things that they enjoy doing, like exercising or like social events. How are the stress levels overall? All of those things are demands on the body. And if you have a lot of those things going on in your life, then your water level is going to go up. And because you have previous trauma to the area, it doesn't take much of those stressors to actually overflow your glass. So people just generally blame the now. They just blame what happened in the moment. Oh, I bent over and I picked up toothpaste and I injured my back. But they don't look at what has been going on. How well have they been moving? How conditioned are they? How healthy are they? All of these things are going to be a factor. So really, when pain is persisting like this, it really has to be looked at it from a broader perspective and not just look at it from, am I re-injuring that area? Do I keep tearing the muscle? Is it just going into spasm to protect? Yes, it's probably going into spasm to protect. But what else is going on? And really the first thing that I would be looking at there is the language. Because the language that is using there is fearful, I'm worried, I'm scared, I'm frightened, all of those things. That's speaking volumes to me to say, okay, this person doesn't feel safe doing particular movement. They're avoiding doing certain things, and you can only avoid things for a certain amount of time. And then someday when you're not thinking, you're in the rush, you bend down to pick up something, and that's when you injure yourself. So that's really my advice to this person, is really to find somebody that would look at things from a broader perspective and not just look at it from a muscular point of view and trying to strengthen up the muscle. Really dive into the thought process around his behaviors and dissect that, and then rehab around that. So if somebody came in for me with a similar story like this, I would be trying to figure out what they don't feel safe doing and get them better at it on a scaled down version. I will try to see if we can find a way of building resilience and building strength and conditioning and reducing fear within that area, with that position, and then scaling up from that. Yeah. And other things there are actually pointed up about as well, like lifting advice. I'm always skeptical when I hear lifting advice. Sometimes lifting advice, it should be taken with a pinch of salt.